Hey everybody, so I'm back with another update. This week I am 29 weeks, so one more week until I'm in the 30s, which is awesome. I don't have a ton to update on this week. There hasn't been a whole lot going on. I haven't had any appointments or anything like that. However, the one thing that I did have happening, I know I kind of mentioned it in my last video, was the swelling of my feet, mostly in my right foot. So I talked to my doctor about that, and they were a little concerned that it was mainly one foot versus the other that seems to be taking on majority of the swelling. So they did have me go in on Wednesday to be monitored and to have like an ultrasound done of the veins and the blood flow in my leg, just to make sure I didn't have any blood clots or anything like that. And thankfully all of that came back clear. And then of course, you know, my doctor followed up with me on Friday, or early Friday morning, and they were just like, you know, if there's anything else, if this continues to happen, if your foot gets really swollen again, call us, we'll have you come in quickly and we'll monitor you here in the office. Well, of course, they called me in the morning. At 12:15, I noticed my right foot was almost double the size of my left, and so I called my doctor's office, just like they said, and they close at noon on Friday, and I didn't realize that. So I started kind of not panicking or anything, but I wasn't really sure the best thing to do. So I called the labor and delivery, the on-call where my doctor practices, and they basically told me that I should come in just to be monitored, just to have everything checked, because that's what my doctor had originally said that she wanted. So that's what I did. I went in and I had the full monitoring done. It wasn't just my one leg, because they had ruled out a blood clot. This time they were monitoring for everything, and they wanted to really check all the signs, mainly for preeclampsia, just because of the swelling I have going on. And thankfully everything came back just fine. All of the tests were good. It was kind of funny when they hooked me up to the monitors, the babies immediately started kicking exactly where the monitors were. And even the nurse was laughing, and I thought it was hilarious just because they knew exactly where to kick and where to poke, and you could hear it on the little monitoring thing. So it was not necessarily fun. I mean, I didn't want to be there. I didn't want to be panicking, but you know, it's always nice to kind of be reassured that everything's okay. And because my doctor had told me to go in if anything happened, I'm glad that I did. You know, it's better to be safe than sorry. And thankfully, you know, nothing was going on. So they just think that for some reason my body favors my right side as far as being swollen. They don't really know exactly why that's happening. I do know, you know, what to look for just in case it is a blood clot that they missed or anything like that. But other than that, I mean, it's been pretty low-key week besides the swelling. I do, you know, prop my feet up most days. I have been just kind of laying low. You can see me at home sitting on the couch with my feet up on pillows, just because, you know, they do get swollen by the end of the day. And yeah, that's kind of it. I forgot to tell you guys the difference in the apps this week, which is what I usually do at the beginning of the video, but this week my Pregnancy Plus app, I finally have moved on from the size of a papaya. I think it took like 5 weeks to move on from that. And this week and the next couple of weeks, they say that the babies are the size of winter squash. And I wasn't really sure exactly what a winter squash was, but the picture that they have is of a pumpkin. So I would imagine it's, you know, a smaller size pumpkin. Obviously they're not these gigantic pumpkins in there. And then the What to Expect app says that they are the size of small heads of cabbage. So really, according to the apps, the baby should be right around 2.5 pounds. And I think they're supposed to be measuring between like 16 to 18 inches long. And that's obviously, you know, per baby. Everybody's different. Every baby is different. However, the weight thing, we know that according to the anatomy scan that I had previous to my last video, both of the babies are weighing in at over 3 pounds. Or at least, you know, I don't know exactly how they do their calculations. I know that they measure their femur bone So I'm not sure exactly how accurate the weight part is, but that's what they're saying. So, you know, my babies have always been a little on the bigger side, which I'm not going to complain about. Having twins, it's better for them to be a little chunkier than not, just in case they do come early. However, I have told them that they are not allowed to come for the next couple of weeks because Chris is training right now and he's out of state. And although I have like an emergency plan, I have my friend as backup, I have, you know, people that I can call, we have a plan. It would obviously be better if Chris was here. So they're not allowed to come out, which is why having to be monitored twice this week. I wasn't trying to freak myself out. I wasn't trying to overthink anything, but you know, I did want to make sure everything was okay just in case, because I don't want to do this by myself. So anyways, I think that's kind of it. Like I said, there hasn't been a ton, just the thing with the swelling of my feet. But other than that, everything is good, and I'd rather, you know, it be a little more on the boring side than not. That means things are moving right along, and yeah, I can't believe that next week I'll be in the, you know, the 30-week mark. It's just one more step in the right direction. So I will show you guys my belly, because again, just like last week I said, I just feel huge. I am pretty uncomfortable most of the time, but I think that's just par for the course, and that's okay. So there's the belly, and yeah, I just, you know, gigantic. All right, well, I hope you guys all have a great rest of your week, and we'll talk to you next week.